Our involvement with a health crisis, in particular with our department, would be something of perhaps a mental issue where a student is having mental situation which may make them suicidal or just in need of help. When we're dealing with a suicidal student, as it were, we have special training for officers and enabling them to deal with such a crisis. Recently, we had a situation where we had a student actually on the parking structure who was going to jump off the parking structure, and we were able to observe this on camera after receiving calls. Our officers responded to the scene, and due to the fact that the subject on the building heard the sirens, he got down off the ledge, as it were, and the officers were able to make contact with him and get him the help that he needed. As it turned out, this particular subject was off his medication, and without that ending the way it did, it could have been a much more tragic ending than what it was. I've been here a little over 23 years now, and I would say, unfortunately, there's been an uptick in the mental health issues that we have dealt with here on campus. But it's not just our campus, it's really a nationwide epidemic, as it were. But again, with my time here, in the past, I'd say 5 years, I've seen a pretty good uptick. Our officers are responding to issues involving mental health and suicidal tendencies from students. It would seem that the uptick, as it were, is because students are facing more issues today than they were, let's say, 10 years ago. Not only the pressures of school, but just the pressures of life in our society today. The things that go on around us on a day-to-day basis. And my own belief is that it probably plays into it.